Hi, I'm Paul Mears, Chief Executive, and I'm going to just give you an update from the September board meeting. We started, as always, our board meeting with a patient story, and this month we had a really interesting story from one of our patients who has a syndrome called Williams syndrome, which is something I hadn't heard about before, but it's basically a condition that makes people very friendly and perhaps over-friendly sometimes, but also is characterised by people being quite anxious and dealing with quite a lot of anxiety. And the patient who came along talked to us about how the experience of coming into hospital could be quite difficult for people with this syndrome, and it was a really interesting opportunity to hear firsthand how we can try and improve the way we interact with patients to put them at their ease, deal with those anxieties. So a really good opportunity to hear directly from a patient about their experience of coming into Yeovil Hospital. We also talked to the board this month and spent quite a lot of time talking about the work we're doing around pediatrics and maternity. Many of you in those areas will know that Dorset Clinical Commissioning Group have undertaken a big review of services in Dorset, and as part of that work, we and Dorset County Hospital in Dorchester are starting to develop some thinking about how we may be able to integrate and develop our services for paediatrics and maternity in a more joined up way across the two organisations. We're also now working with Somerset Clinical Commissioning Group to see how that would fit within the wider context of Somerset. So a lot of work going on between our two organisations with Dorchester, and we've now signed a memorandum of understanding to work together to develop those options into a further proposal that will come back to the boards later on in this year. We spent a lot of time also at the board talking about the current financial challenges the organisation faces. As you all know, we've got a significant financial pressure this year. We have to deliver a significant amount of savings. At the moment, we still have a gap in terms of our planned efficiencies and savings for this year, so we've got more work to do on that. And the board spent a lot of time talking about that within the context of the environment we're working in and the challenging picture there is, not just for us as a hospital, but also for our local commissioners in Somerset, who are also facing some significant financial challenges. We had a really good update from the Research and Development Department, and again I want to recognise the huge contribution the R&D department make to this organisation. We've got a great team of people working in R&D, and we heard from Jo Allison, the lead research manager, and also Nada Francis, one of our primary researchers, looking at how research can really improve the quality of care we provide and the innovation we're able to provide in clinical practice by having a really active research department here at Yeovil Hospital, which is one of the best in small hospitals across the country. We also had a report on operational performance, and really pleased to see how strong our operational performance is. We're consistently achieving the 4-hour standard for patients coming to A&E, and we're now one of the best performers in the South West for our waiting times. So patients are being seen quickly when they are being referred by their GP to Yeovil for elective care treatment. However, we know that winter is on the horizon, and winter is always a challenge for us in the NHS, but we have a really strong and robust winter plan which we've developed internally within the hospital and as part of the wider Somerset winter emergency plan, and we are going to be having a further presentation of that at the board in October. We also reviewed the workforce performance and again looked at recruitment. We're doing really well on our recruitment of nurses now. We've got a number of nurses being recruited from the Philippines, which is helping fill our vacancies. We've still got some vacancies still to fill, but compared to where we were this time last year, a much better place in terms of our recruitment into nursing vacancies. And we also looked at things like our appraisal rates, and again we have some challenges there because our appraisal rates aren't as high as we would like them to see, and I'd really encourage everybody in the organisation to make sure that they are having their appraisals. It's a great opportunity to make sure you're reflecting on your practice and your performance. If you're a member of staff, make sure you are asking your manager for your appraisal, and if you're a manager, please make sure that you're fitting in the appraisals, which are a really important part of your management of your team going forward. So we talked a lot at the board about how we can try and encourage that and make that as simple as possible for people to make sure appraisals are getting done on time. So a very busy board, lots of very big discussions that are going on, reflecting really how much work and innovation is going on across the hospital and the local health community. But we had a good meeting, and hopefully look forward to giving you a further update from the October board next month. Thank you.